Taoiseach, when your predecessor and now Cabinet colleague was announcing a lockdown, we were all very clear that what was required of the public, and the public did what was required of them. We were told that this was because we had an exceptionally, hospital capacity was an issue across Europe, even in Germany and Italy, which have a much better healthcare system than we have in terms of preparedness. We were told that our capacity was particularly low and therefore we had to be particularly careful. Now, at the start of this year, the permanent adult critical care capacity in this country was 255 beds. Funding was provided in March for an additional 40 adult beds and 2 paediatric beds. Have those beds and those units now been built? Are they ready for this autumn as we face into winter? The previous Minister for Health, Deputy Harris, and I had reminded him just as he slipped out of the chamber now in May, accepted that crowding was unacceptable in UHL, and if not addressed, would be a disaster this coming winter. And he accepted that additional procedures would be required to be carried out in the Tier 2 hospitals that surround UHL, Ennis, Nina and St John's. Now, I didn't hear any more from Minister Harris on that because he changed portfolios, but we did hear from Dr. Liam Woods at the COVID committee, and he confirmed that this was indeed the case and that plans were underway to increase the procedures. Instead of that, all surgeries were cancelled a couple of weeks ago in Ennis. Now, thankfully, they were reinstated. And in direct response to overcrowding in UHL, all elective procedures have been cancelled this week. So that's putting further pressure back on waiting lists, deterioration of quality of life, and indeed life expectancy in many cases. Swabbing and testing is essential, as yourself and Deputy Mary Lou McDonald agreed. But up to now, we have had public health dentists, we have had speech therapists, and we have trained professionals in our healthcare system diverted to testing. Now, I'm not saying testing is important. It's hugely important. But 6 months into this crisis, they need to go back to their normal jobs. And it is inexcusable that people have not been trained up and put in place to carry out testing such that dentists, speech therapists, etc., are not being diverted to doing it. Can you tell me what's been done with what is now the permanent adult critical care capacity in this country 6 months later? What's happening with regard to the UHL hospital group, and what's happening with regard to the persons carrying out testing?
Thank you.
Yeah, 3 things. First of all, the current total adult critical care beds open and staffed is 278. And in relation to total PEDS, as paediatric critical care beds open and staffed 30. And occupied adult critical care beds 218. Occupied paediatric critical care beds 23. And the critical adult care beds reserved for patients 13, and paediatric critical care beds reserved for patients 1. So the 600 million agreed by Cabinet this week as part of the winter initiative, and essentially a COVID winter initiative to take us through specifically the next 6 months, is designed to allocate resources to, first of all, reduce pressures on emergency departments and innovate around community respiratory clinics, for example, so that as a preventative mechanism to intervene so that people don't end up in emergency departments as they have in the past. And also in terms of the creation of more bed capacity, both in acute but also in non-acute facilities that would equally facilitate people coming out of hospital in a timely manner once their treatment is over. And also in terms of community diagnostics, and also where we can continue with elective procedures separate from the trauma hospitals, that should be done and accelerated. And the HSE knows that any capacity it can in the short term or medium term deliver will be funded and will be resourced. And that's probably the largest winter initiative in a while, necessarily so, because we are anticipating very significant challenges on that front. In relation to your point on testing, I agree. 12 weeks in office, I believe a permanent workforce is required for testing and tracing. That's what's happening. That's what's detailed in the plan that we published yesterday, to have a dedicated testing and tracing team that would work side by side with the health service personnel. When it was originally established in response to the pandemic, yes, people were drawn from different disciplines within the health service. There was a view that in the initial phase a clinical decision maker is required. But without doubt, as we expand and ramp up testing, tracing even more than it currently is, that requires a dedicated workforce. And in the plan, the figure identified as there will be 3,000 all involved in testing and tracing employed, which is a very significant number of people, but again, necessary nonetheless. In terms of University Hospital Limerick and in terms of the Midwest, there are, without question, very significant pressures there, and I will be in touch with the Department of Health and the Minister and the HSE with a view to measures to alleviate the situation in the Midwest.
Minister, I note what you plan to do over the next 6 months, but I suppose my question was more about what was done over the past 6 months. And I suppose the public are justifiably sceptical about ministers with plans. And I mean, we've been hearing about what's planned for the health service since you were Minister for Health. Now, it kind of begs the question, how many health ministers does it take to change a health service? Because there are 4 including current and previous Ministers for Health in your cabinet. Of the 40 beds, critical care beds, which were the most important shortage that we had in this country relative to others, of the 40 funded 6 months ago, 23, if I understand your figures correctly, only 23 have been provided, a little over half. Nothing concrete, it seems, is planned for UHL other than aspirations. And I appreciate that, yes, Minister, or Taoiseach, you're 3 months in office. But these are 3 months when we were looking down the barrel of the gun of a winter crisis, which is hopefully won't arrive. If the medics and the predictions are incorrect by NPHET, it won't happen. If they are correct, then we're facing a calamity and we need to move. And we don't really need to hear much more about plans, we need delivery. And the delivery over the past 6 months doesn't inspire confidence, frankly, in what can be delivered over the next 6.
To conclude, please.
Well, just on the testing and tracing, the recruitment campaigns are already underway. In terms of testing and tracing, the recruitment campaigns are already underway, not just plans, they're happening and they're being recruited. And in terms of just, those are the figures open in staff now. They may not be exactly what's available, and you know as well that during the pandemic, a significant number of acute care beds and critical care beds were made available. Surge capacity was created, and that applies here as well. I just wanted to give you the most up-to-date operational details as provided by the HSE in terms of the number of critical beds available. And there is ongoing work in terms of procuring additional capacity as well. On an initiative by initiative basis in terms of the private sector capacity that's out there as well, in terms of making sure we can get some elective procedures done and that elective procedures are not suspended as a result of overcrowding in the emergency departments and in the trauma departments. But I do intend to engage with all concerned in terms of the Midwest in particular, because there was a question, if you look over the last 2 years, there's been ongoing pressures on the Midwest and particularly University Hospital Limerick.
Thank you, Taoiseach. That concludes Leaders' Questions.